we go. Dr. Kiriluk, you get the first statement. Let's get your opinion on this. So here we go. Dr. Kiriluk, here's a statement. IBS is similar to inflammatory bowel disease, aka Crohn's disease and ulcerative colitis. Myth or fact?
That is a myth.
Please explain.
Okay. So endoscopically, if I do a colonoscopy on a patient with inflammatory bowel disease, which encompasses ulcerative colitis and Crohn's disease, these are inflammatory conditions. When I go in, I would see visually with my own eyes changes in the lining of the mucosa. So there would be redness or swelling, sometimes ulceration. So I can usually tell just by looking at the mucosa that they possibly have inflammatory bowel disease. In terms of irritable bowel syndrome, the lining, typically it looks normal unless they have polyps or things like that, but no signs of gross inflammation. And another thing that I want to clear up is that for inflammatory bowel disease, there is an increased risk for colon cancer. But in patients who have irritable bowel syndrome, there is not an associated increased risk for colon cancer. Some of my patients with inflammatory bowel disease do have overlapping irritable bowel syndrome, though, as well.
Okay.
So.
Well, thank you for clarifying that.
Absolutely.
That's super important to break down. Thank you. Here we go, Chef. Here we go. Myth or fact? Maintaining a healthy diet, drinking water, and minimizing stress are some ways to best support healthy living in individuals with IBS.
Fact.
Please explain.
Yes, yeah, absolutely. I think, of course,
It's fact.
Fact. There's a lot to do with having enough hydration in your body, and of course your lifestyle. Truly, because we know that a lot of different things, stress related, can feed whatever issue is going on, and it exacerbates it, I should say. So yeah, absolutely. I think lifestyle makes a humongous difference, myself included. I definitely understand. So yeah, it really has helped out with, in the healing process.
Wonderful, thank you. Here we go, Dr. Kiriluk. Here's a statement. Quote, "This treatment works for someone I know with IBS, so it will also work for me," end quote. Myth or fact?
Myth.
Please explain.
Okay, so even the low FODMAP diet, not everyone responds to it. So, actually about half respond, assuming that you're doing it correctly. And then even certain pharmacological treatments, not everyone responds to a treatment. So sometimes I just ask my patients to have a little patience, because it can take some time to figure out the right treatment for them, and one that minimizes side effects and that their body responds to.
Wonderful, thank you. Here we go. Chef Lasitra, here we go. Here's a statement. Eating a whole foods, plant-based diet does not offer benefits in IBS patients. What's your think?
Myth.
Please explain.
Yeah, no, absolutely. I think the more nutrient dense that you can make your plate definitely helps out with supporting and also clearing. In my case, it's strep is the leader for the IBS that I had tests done too. And so in order to kind of help cleanse and clear the body of that, now you don't want to obviously completely clear your body of it, but that definitely happens better when you're eating more plant-based and really nutrient-dense foods. So absolutely, it does help. So
wonderful, thank you. And again, I've done plenty of shows about the power of plant-based nutrition. Check them out on my website, of course, www.drmarkcombs.com. Really, that is the movement where you want to go. That's where the best health outcomes are showing up when we're looking at the literature. So trying to get to predominantly whole food plant-based is definitely the way you want to go. Here we go, Dr. Kiriluk, here we go. Here's the statement. We'll do a couple more of these. I like this one. IBS occurs in patients of all ages and racial/ethnic groups, but it is more common in women and in younger adults.
So that's true. So it's 14% in female, 9% in males in North America, 11% internationally, so it does occur worldwide. It's diagnosed more commonly in younger patients, but there are patients who are older who have probably had symptoms, for the past possibly 20 or 30 years. So even if I diagnose it later on in life, it doesn't mean that, I may have to rule out other things as well, but it is a true statement.
Thank you. Here we go. Chef, I like this one. IBS meal planning takes too much time to do. Myth or fact?
I think that's a myth.
Please explain.
I think it takes time to get sick too.
Yeah.
So I think there's a lot that goes into that. And then when you are sick, there's a lot more time that goes into trying to work on a healing process. But I think meal planning, once you have the right techniques and the tools, it's really not that hard. It's easier than people really think.
Wonderful. We'll do 2 more of these. Here we go. Dr. Kier, look, I like this one. IBS is a psychological disorder. It's all in your head. Myth or fact?
That's a myth. So it's not all in your head. It's a very real disease, and we do know that even tying back to our last talk that the microbiome
Yes.
differs in our patients who
Absolutely.
have irritable bowel syndrome, and there is some localized inflammation, not inflammatory bowel disease, but with the bacteria and how they interact with the lining and things like that. So this is a real condition, and the digestive tract is different and how it responds, the enteric nervous system and how it interacts with the central nervous system is dysregulated, but it is a real condition, and there are, things, scientific studies that have shown that these patients differ than patients who do not have this condition.
Wonderful. Thank you. Let's do this last one. I like this one. Chef, here's a statement. Many restaurants will not accommodate my IBS dietary restrictions. Myth or fact?
Myth.
Please explain.
There's a lot of, all you have to do is just ask. And if you know what you need and what you want, there are a lot, and working in kitchens too, I understand, you just need to know. We need to know what's going on, what it is that they need. And so you'll accommodate. They'll accommodate, yeah.
I always say, if I break up my credit card, they'll definitely accommodate.
Yeah, that'll help, right? Yeah.
Here's the cash show. Love it. So there you guys go, myths versus facts. Great segment. So we got about 5 minutes left now.